थोड़ी सी डिम होगी. A very good afternoon to all of you. I'm Dr. Sonia Dhaka, consultant medical oncology, cancer specialist at Gratian Super Specialty Hospital, Mohali. Today, I'm here to discuss a very important yet very sensitive topic, that is childhood cancer. As we know that childhood is a time of immense potential and unlimited dreams, endless desires. But for kids with cancer, it turns out to be a tiring and long battle, and which not only impacts them, but also has a great impact on their on their other family members. So, the need of this discussion is becomes all the more relevant when we realize that a large number of these kids with cancers, they succumb to their disease only because of lack of awareness. Every year in India, 50,000 of kids are diagnosed with cancer, a new diagnosis every year, and out of this, a vast majority is curable if it is detected in time and treated well in time. If we take a comparison with the Western countries, in West, despite a very high cure rates in West, in India, unfortunately, 70% of these kids die because of their disease, largely because of a late diagnosis, inadequate medical facilities, and a high cost of treatment. So, when we want to raise awareness on this topic, what is the foremost thing to know is to be aware of what are the common cancers which can occur in kids, and what are how they can present clinically, what are their symptoms and signs which can be as usual as a fever, or it can be a rare symptom or sign as well. So here, what the cancers, what we see in adult population, in adults, like there is lung cancer and colon and stomach. What we see in adult patient is these cancers are rarely seen in children. So they have their own set of growth development abnormalities, present as cancer tumoral growth. The median age of diagnosis in these patients remain around 6 years of age. And generally, the most common ones, what we see, what the most common cancers, what we see among them is leukemia. So at the topmost position is a leukemia, that is a blood cancer, which is popularly known as. And now, as we know that there are three components of blood, human blood. There are red blood cells, white blood cells, and platelets. And each one has their own function to serve in the body. The function of red blood cell is to deliver oxygen. White blood cells, the main function of white blood cells in the body is a defense against infections, which form our immune system. And next is the platelets, which prevent which most of us would be aware that platelets prevent bleeding. They are a defense against the bleeding in our body. So when we talk of leukemia is a cancer of white blood cells. And in cancer, when we talk of cancer, these cells which are normally produced and they die, they are here to survive for a few days to few weeks. But when in cancer, these cells, instead of dying their natural death, they go on an overdrive of growth, and they grow abundantly, abnormally, and without serving their own function. And in doing so, they also crowd out the normal body cells which are there in our bone marrow, and not thereby in the other cells of the body, they are also not able to perform their usual functions. So how a child can present, how a child with leukemia can present. So because of lack of function of white blood cells, child would find it difficult to cope up with infections. So child will have recurrent infections, recurrent fever, And due to malfunctions of platelet, a child can have easy bruisability, spontaneous bleeding tendencies, and bleeding with just minor trauma. These are some symptoms what child can have. Apart from this, diffuse body aches, diffuse bony pains. Child can have diffuse bony pains, and because of anemia, because of hampering of function of red blood cells, which present as anemia. So anemia can make the child lethargic and feeling them weak. A child may refuse to play out, and these child just may not behave their usual self. And for a vigilant parent, these change, it's not very difficult to notice these changes, and to bring out these. What is more important is whenever a parent, because parent are the first person to notice any change in child behavior. It could be a teacher also, it could be their schoolmates, friends also. Whenever any something like this is noticed, this should be brought into the notice of your doctor, who can go with further checkups. So next, when we are talking about blood cancers, next in line would be lymphomas. Lymphomas are the cancers which cancers of our bodies, of our tissues, which are in our lymphatic system. For most of the school children, and obviously the teachers would know that the lymphatic system of our body is spread throughout our body and has a very important role to play in our defense mechanism, in our immune system. So considering that this lymphatic system is spread throughout the body, like the main organs include the tonsils, spleen, and various lymph glands which are scattered. So the child usually present with a swelling or a lump, which can be anywhere, ranging from a lump can be present in the neck, it can be present in the axilla, it can be present in groin, chest, or abdomen. Any lump, any progressive lump should be taken care of, should be shown to a doctor. And apart from this, apart from a swelling or a lump, child can have unexplained fever, recurrent fevers, and weakness, generalized weakness, refusal to play, refusal for outdoor activities. And apart from this, unusual sweatings can happen, unexplained weight loss can happen, which is unintentional. And so these are some things which are seen with lymphoma. And if a parent or anybody else close to the child is noticing any of these, that should be dealt with. Now we talk about the solid tumors. So what are the solid tumors, solid organ tumors? These, we have been talking about the blood cancers. So when we talk of solid tumors, brain tumors and the tumors of other central nervous system in our body, brain tumors are the most common solid tumors which are found in children. And these tumors, they can include the other part of the central nervous system also, like it can include the spinal cord as well. So these tumors many a times can be benign as well, so can be easily taken care of by a surgery. For other malignant ones, a multimodality treatment is required, which includes chemotherapy, surgery, and radiation. So a child can have a persistent or an intermittent headache, which can be associated with nausea, feeling of nausea, can have vomiting can be there. Apart from this, a new seizure onset in new seizure disorder, and vision abnormalities, gaze abnormality. These are something which can present. But see, the idea here is to be aware, not to be of panicky of any such things, because in most of the cases these complaints are benign and not cancerous, but better be decided by the doctor. So next, in solid tumors, after brain tumors, as we have discussed, comes the neuroblastoma. Neuroblastoma is our second most common tumor, which is a solid tumor, which is found in children age group. And the unique feature of this tumor is that it usually presents in the very early years of the child. Like it usually present by most common age of presentation is before 2 years of the child. So it is basically a cancer of immature nerve cells, which are distributed all throughout the body. And the most common place would be adrenal gland in the body, which are situated just above the kidney. So here, child would usually have a small child would turn irritable, and progressive abdominal distension can be noticed. The swelling will be progressive, and when progress with a progressive abdominal swelling, the child can complain of abdominal pain. A child can develop recurrent fever, persistent fever. So these things should be taken care of. After neuroblastoma, next in common would be bone tumors. So bone tumors are pretty common in younger age groups, and osteogenic sarcomas are amongst the most common. Osteogenic sarcoma remains the most common bone tumor found in children, and the 85% of these cases, they are located around the arm or the legs of the children. So that makes it easy to notice and easy to diagnose. So bone tumor usually presentation would be a progressive bone swelling, which would be around the joint in the child, and sometimes in the late stages can be associated with persistent pain and later on fever as well. And after bone tumors, the next common tumor would be a kidney tumor, which is not so common, but still rare, seen in younger age group. These kidney tumors are different what we see in adult age group. They are also called as Wim's tumors. And the usual age of presentation would be less than 5 years of age. Child would present with a progressive abdominal distension, abdominal mass. What is unique about the presentation is that the mass can grow to a very big size even before appearance of other sign or symptom. Apart from a progressive abdominal mass, the child can have hematuria, that is passage of blood in the urine, and abdominal pain can be associated, and hypertension also in a few cases. Other rare tumors which are seen in younger children, is soft tissue sarcomas, then retinoblastomas. Retinoblastoma is as the name suggests, it is a tumor which arises from the retinal layer of eyes. Child will usually have a white reflex from the pupil, a cat's eye reflex, what we call as, and squint. Child can develop a new onset of squint, can have strabismus, and gaze abnormalities, progressive swelling of the eye in late stages. These are the features of retinoblastoma, which is a familial tumor. So then apart from this, there are many rare varieties which we would be skipping in this talk because it's going to be that because of limitation of time. So next is whatever tumor, what we have seen till now, that whatever tumor it may be, there are always certain red flag signs. So these red flag signs should be known to all the caretakers of the children, be it parents of their teachers, or your schoolmates. These red flag signs should, whenever noticed in the child, should be brought to the notice of the pediatrician, of the doctor or oncologist, whoever is available. And being aware is eyes don't see what the mind doesn't know. So it is most important to be aware that what are the most common tumors which are arising, which are known to arise in children, and how variably they can present in a child. That's how we can have a vigilant approach to these childs. The idea is not to be panicky, but to be aware, so that things can be done, things can be proceeded well within the time limit. Early diagnosis, that is the whole aim. The earlier the diagnosis, the better is the cure, and better are the chances of complete cure. So diagnosis is to be confirmed by a battery of tests after having noticed certain these signs. A battery of tests are undertaken, which will include a routine blood investigations, which can include a biopsy, certain scans, a CT scan, MRI scan, or bone marrow examination. That varies from case to case, according to the diagnosis. Then there are some molecular tests, some genetic testing, familial screening in case if a hereditary tumor is found. So the siblings are to be screened, the other family members are to be screened if there is any genetic linkage to the tumors. Now coming to the treatment, so treatment of these tumors of childhood, the on the bright side of it is that most of the childhood tumors, they are completely curable. Most of them, 70 to 80% are curable if they are diagnosed in early stages. So early stage remains the utmost important, remain the most important aim. Treatment remain, there are three main modalities of treatment, that is chemotherapy, radiotherapy, radiation, that is, and next is surgery. So these are the three main important components of the treatment. That depending upon what diagnosis it is, what the stage of disease is. So sometimes, most of the time, multimodality approach is accepted in most of these cases. And they sometimes the treatment can be very lengthy and exhausting for the child, and not only for the child, but also the other the entire family remains affected. The siblings of the child are affected, and apart from this, there are certain long-term adverse effects which are known to which happen in these kids with cancers, and which can hamper in long run. It can hamper their physical growth, their mental growth, their psychosocial growth, uh, hair fallout, and the physical body changes can make them feel different from their peers. A child can develop major trust issues, where the world may not feel a safe place anymore. So by taking a combined approach, by putting our combined efforts, not only by parents, by teachers, by friends, so we can develop a cordial atmosphere for these kids, and thereby providing strength in their long battle, in their tiring battle, which they are fighting and winning every day by their exemplary courage. So here we just take care of our kids by just being aware and attentive to their small to small and big complaints, to these symptoms and signs. So we can be careful, and we can participate, we can contribute in this awareness of childhood cancers. So together we can and we will win this battle. So thank you. And Dr. Sonia, our team from Gratian Hospital would like to hear from you. For any queries, please reach out to us, write to us. We would be very happy to answer all your queries regarding this, regarding childhood cancers, how we can diagnose at the earliest, how we can treat at the earliest, and how we can offer the bestest of cure. Thank you, and keep safe, remain safe, and love to our dear children. And we just wish for their better health. Thank you. Namaste.